taking the pressure off after a recent joint replacement, plus tools to enhance romance for both partners. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to explain why single men are opting for vasectomies. But that's later. First, let's take on severe questions.
Here we go. Our first question of the day, Dr. Leah. A man says, I met a woman who isn't monogamous, but I really like her. Any tips to make a non-monogamous relationship work?
Well, a non-monogamous relationship can really mean a variety of things, anywhere from dating other people to engaging in sexual intercourse with other people. On the plus side, this type of relationship can help with self-growth and may even deepen your desire for your primary partner. But to make it work, you really need to set some ground rules. Ask your partner the right questions. Do they want multiple different partners, or do they just want to repeatedly see one person besides you? Would she spend the night with that person, or even bring that person home if you're living together? Having clear rules or boundaries will make it easier, and you should keep the conversation going. Reevaluate the ground rules, and if non-monogamy is right for both of you.
So, Dr. Leah, so how do you know if this type of relationship is right for you? And when would you advise against it, for example?
Well, I think all too often, one person wants it and then the other goes along with it to make him or her happy. And that's when you get into trouble. Plus, you need to be sure that you are not choosing non-monogamy to cover up other problems in your relationship. Plus, I've also seen instances where only one person is allowed to be non-monogamous, and clearly that imbalance can cause some problems.
You know, I never quite understand that, why somebody allows themselves to do it, but they won't allow the other person to do it. It doesn't sound right, right?
The instances I knew, it was highly successful athletes that did very well, and basically their attitude was like, I want to be with multiple other partners. You know, you can stay or you can leave. You know, it's not a relationship I could imagine, but I mean, I guess at least they were honest. Because some people will just cheat without telling their partner, at least they were honest with them, so.
Yeah, give them credit for that.
Yeah.
Okay, our next question, Dr. Leah. A woman says, are vaginal rejuvenation procedures that don't involve surgery?
Yeah, there are. There is one called V-Laze. It's a non-invasive procedure that uses the heat from a laser to stimulate the production of collagen and blood supply to add thickness and elasticity to your vaginal wall. It could also reduce dryness and mild involuntarily battery leakage.
Okay, you're saying minimally invasive. Does that mean it won't hurt or anything like that?
Well, the procedure doesn't require anesthesia or medication. And supposedly most women don't feel pain during the treatment, but I've had laser hair removal and I know that it can be painful, so I really don't know how much this laser hurts or not. But this procedure can last about 30 minutes and you need 2 treatments within 2 weeks of each other. And the best results are noticed within 3 to 6 months of treatment. And you should also take several days off before having sex.
So have a lot of patience because it will get better. Okay? So when should someone consider this?
Well, you may want to consider it if your vagina is just not as tight as it used to be due to age or childbirth. You could also consider it if you don't produce enough lubrication, which can make sex uncomfortable or make you feeling a little unsexy after menopause.
Okay. Our next question, Dr. Leah. A woman says, I get tense during sex and have a lot of gas. What can I do?
Well, you need to discover whether or not it's vaginal gas or gastric gas. Vaginal gas is when you pass gas through your vagina. It happens when your vagina releases air trapped inside, and it's an involuntary function that can be caused by sexual activities, using tampons, or weak pelvic floor muscles. Since this is a normal occurrence, you really can't do much to prevent it. But if it's causing you pain or disrupting your sex life, obviously you want to go talk to a doctor. If it's gastric gas, there are things that you could do, especially when it comes to your diet. Reduce high fiber foods like beans. Hey, it's that magical fruit, right? And other veggies. Plus, and this is a big one, eliminate sugar substitutes. This includes anything even from like way too much sugar-free gum. That could all make you gassy.
Can sugar make you gassy?
Sugar typically doesn't make you gassy. It's the sugar substitutes that will make you gassy. If you ever eat too much sugar-free candy, you'll find that out.
Okay. I'll remember that next time I chew some gum, if this is causing that.
Yeah, like a piece of gum or two isn't gonna bother you, but like I'm a chronic gum chewer when I get stressed. Okay. And so if you're chewing like pack after pack, You'll notice.
Are they chewing sugar-free gum?
Oh, yeah, I do.
Oh, okay.
And chewing sugar-free gum is much better for your teeth than chewing sugar gum. So it is better in that sense. But I mean, anything that's sugar-free candies, they'll get you.
Okay. Is there anything else can help?
We know turmeric is one of nature's most powerful anti-inflammatories, and it also helps stimulate the gallbladder to reduce bile. Turmeric is known to combat indigestion, bloating, and gas. Activated charcoal will also help reduce gas. Beano or Beano Cyst can also be helpful. Gas X is absolutely wonderful. Plus, there are other positions that you could try beforehand that can help you pass the gas.
Positions to help you pass gas. Oh, really? Like what, for example?
So they have a thing called the happy baby. So this is actually used with like infants if they're having issues trying to pass gas, because having gas can be really painful, right? So a happy baby where they'll like lie down and pull their toes or knees to their chest with their hands like over their knees or over their actual feet, kind of like pulling up. So think of what a little infant does when they're really flexible. Or child pose, which is common in yoga. So like imagine you're on all fours and then you're gonna lean back to your glutes, hit your heels, and extend your arms all the way up. So all of these can help kind of pass the gas along. Hopefully that helps.
You know, I know you all have a wealth of information. I admire you, but I think you just got a level higher learning how to. Wow, thank you.
Gas can be painful. Let it out.
Still to come on Sex Talk. STDs with few symptoms. Single men and vasectomies. Signs of a weak pelvic floor.
There are several sexually transmitted infections that don't cause obvious symptoms. Here are some of the more common ones.
Sexually transmitted diseases, or STDs, are a significant public health concern, and while many people associate them with noticeable symptoms, several have subtle or even no apparent symptoms. Chlamydia and gonorrhea are two classic examples. Many individuals infected with chlamydia or gonorrhea don't experience any symptoms, especially in the early stages. However, if left untreated, they can lead to serious complications, such as pelvic inflammatory disease or PID in women, and can increase the risk of infertility in both men and women. Even herpes can be tricky to detect. And while herpes doesn't typically lead to severe health problems, it can be painful during outbreaks and is a lifelong condition. Regular testing, safe sex practices, and open communication can help you detect and manage these infections early, preventing long-term complications and ensuring a safer, healthier future.
Whether it bothers you or not, don't be afraid to bring up any potential symptoms with your doctor. Coming up, sex toys for both partners. Plus, a men's health expert talks about why vasectomies are getting popular among single men. That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have Director of Reproductive Urology at University of Miami, Dr. Ranjith Ramasamy. Thank you so much for joining us.
Thanks for having me here.
So today we're talking about vasectomies for single men. So tell us why this would be a good option for a single man that's not even in a relationship.
So ever since the overturning of Roe v. Wade, there's been a lot of fear about pregnancies. And so a lot of single men who haven't yet thought about having kids or starting a family are thinking about getting a vasectomy because of this now fear of potentially getting someone pregnant.
So how common is it for a single man who's never had kids before to want to get a vasectomy?
So before Roe v. Wade, before the overturning of Roe v. Wade, it was rare. So 1 out of every 100 vasectomies that I did was in a single man. Now it's probably about 5 to 10% of the time that is a single man that now desires a vasectomy. So it's certainly gotten a lot more common because of the Supreme Court ruling. but it is now getting more and more common because a lot of people realize that assisted reproduction has also advanced. Freezing sperm before the vasectomy is now becoming a very cost affordable option. And so men want to be safe in this process, and so therefore are opting for their vasectomies.
Well, I definitely commend the men for being responsible and taking accountability there. Is there a downside at all?
Obviously, when you're ready to have children in the future, the whole concept of having sex and having children now goes away, unless you have vasectomy reversal, which is still a very good treatment option for couples who've had a vasectomy that want to have future children. But certainly if you want to use the sperm that was frozen before you did your vasectomy, you're now using assisted reproductive techniques to father children in the future.
So what would you suggest for patients to do before having a procedure like this, in addition to sperm freezing?
I think they should be counseled appropriately. They should know that vasectomy is a permanent form of contraception. They should understand the risks and benefits. It is still a procedure that is most often done in the office, sometimes done under anesthesia. So it carries its own risks. So as long as they are counseled appropriately, they know that sperm freezing is an option. They understand how the sperm can be used in the future as an option. As long as they are aware of the risks and benefits, I think they should be able to proceed.
Was there any other advice that you would give or anything else that patients should know before undergoing this procedure?
Absolutely. So just because you're not going to get someone pregnant doesn't mean the risk of sexually transmitted infections goes away. And so just practice safe sex, just like you're practicing safe reproduction. I think men and especially young men that are getting these procedures should be aware of those risks that come with that as well.
Absolutely. Great advice. Well, thank you so much. We'll be right back with more Sex Talk.
Still ahead on Sex Talk. Simple sex positions after surgery. Emergency contraception versus the abortion pill. Strengthening your pelvic floor. Are SAM-E supplements for you? Healthy sex while pregnant. Toys for both partners.
Back here on Sex Talk, let's take some more questions from our viewers.
I'm loving these questions, Dr. Leah. Here's our next question. A viewer says, I am going to have a hip replacement soon. Once I'm recovered, how can I have sex and take pressure off those joints?
Well, first, make sure you and your doctor discuss when it's safe to start having sex again. Typically, you should plan not to have sex after you have a hip replacement for around 6 weeks. That's how long it will take you on average to recuperate. Then you should stick to positions that won't increase the risk of dislocation.
So for the femur not to pop out of the pelvis, what are some of the, right?
If your femur is popping out, then your doctor did something
No, but
wrong.
the femur head, it's in the pelvis, right? That's a hip replacement.
It shouldn't just, no, but I'm saying it shouldn't be popping like out of skin. So I've only ever seen that once, and it was a really bad soccer injury. So hopefully that's not happening.
Okay, so give us some safe positions then.
All right, for a man lying down where you're on top or bottom with your legs spread apart and toes pointed outward is recommended. You could also have sex from a seated position, but make sure you don't flex your hips or knees more than 90 degrees. If you're ever having sex laying on your non-surgical side, you want to make sure your surgical side is propped up and supported with pillows. Scissoring sideways can also allow you to have the hip that had surgery to be on top without any extra weight or pressure on it. If your doctor hasn't already told you, be aware that some of these pain meds may reduce the production of testosterone and other hormones, which may reduce your sex drive.
So in other words, don't get too creative with the positions, right?
Yeah.
Okay, well, how about for a woman? What can she do?
Well, if you're a woman, the most important thing is not to have your hips flex more than 90 degrees during sex. The safest position for women is missionary, but like men, make sure your legs are apart and toes are pointed outward. Sitting on top of your partner in a chair or a bed is as risky as a position where you are bent over or on your hands and knees. Standing up facing the wall will take the pressure off of your hip and allow your partner to offer additional support.
You know, it's funny because you would think that with a woman on top, it would be, pressure, but you're right. Her legs have to be open to to straddle that. So yeah, that's a good
And
point.
people wouldn't think standing would be beneficial, but standing, you're not bending in any weird way, so.
But a lot of people can't have an orgasm while they're standing. Like,
Some people can't, but you know, there's only so many positions that you can do after hip replacement surgery.
that's true.
So,
Take what you can get.
yeah, exactly.
Got it. Our next question, Dr. Leah. A woman asks, how do I use emergency contraceptive pills?
Well, you need to take the morning after pill as soon as possible after you've had unprotected sex. Read the instructions that come with the package, but mostly you just swallow them like any other pill. Your first period after taking emergency contraception may follow your normal menstrual cycle. It is common, however, to get it either a week early or a week late. If your period is 2 weeks late or more, you should consider taking a pregnancy test. As with all pregnancy tests, you can get a positive result from an at-home test as early as 7 to 10 days after conception, and most pregnancies can be detected before the missed period.
You know, a lot of pregnancy going on here. Words. This is not the abortion pill, correct?
Morning after pills do not cause an abortion. They only work if you are not already pregnant. They can only be taken for up to 5 days after the intercourse. The abortion pill contains medication to induce abortion, and that can be taken only under supervision, and that can be taken up to 70 days after the first day of the last menstrual period. It is used in conjunction with another pill, which is taken to complete the abortion.
Thank you for clarifying that, Dr. Leah. What are the side effects, if any?
The most common of the side effects following the medical abortion pill are those similar to a miscarriage: abdominal pain, bleeding, changes in body temperature, dizziness, fatigue, and any gastrointestinal distress.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
From bladder leaks to pain during sex, there are several signs that you may have a weak pelvic floor.
A weak pelvic floor, although often unnoticed, can lead to a range of frustrating symptoms for both men and women. Common indicators include urinary incontinence, where individuals may involuntarily leak urine during activities like sneezing, laughing, or lifting. For some, controlling gas or bowel movements can become challenging. Weakened pelvic floor muscles can also contribute to sexual discomfort during sex. Fortunately, a weak pelvic floor can be strengthened. Although it may take some time, certain exercises and lifestyle adjustments can help. Consider going to a pelvic floor therapist for a formal assessment and plan to address these symptoms.
A pelvic floor therapist can check to see what's going on inside of you and develop a treatment plan to strengthen those muscles. Let's take on some more questions.
Here we go, Dr. Leah. A man says, can a SAMe supplement help improve erectile dysfunction? Dr. Leah, what's a SAMe?
So SAMe is a natural compound found in your body that helps produce and regulate hormones and maintain cell membranes. While SAMe is a prescription drug, a synthetic version is available as a dietary supplement that you can get over the counter. Some SAMe may help treat depression. Scientists found that SAMe helps produce neurotransmitters such as dopamine, serotonin, and norepinephrine. Taking supplemental SAMe may increase the turnover of serotonin in the brain. It may also increase dopamine activity and inhibit the reuptake of norepinephrine. Irregular levels of these molecules may aid in the development of depression.
You know, you said a lot of tongue twister chemicals there. There's a lot of them. What do they all do, Dr. Leah?
Well, norepinephrine increases heart rate and blood pumping from your heart. If your norepinephrine is low, it can lead to various health conditions, including anxiety, depression, ADHD, headaches, memory problems, sleeping problems, low blood pressure and low blood sugar, and changes in blood pressure and heart rate. Serotonin plays a key role in such bodily functions such as mood, sleep, digestion, nausea, even wound healing, bone health, blood clotting, and sexual desire. We can think of it as the drug that just aids in satisfaction, happiness, and optimism. Dopamine is that feel-good hormone that is associated with rewards and motivation. It's not all good though. Dopamine is behind that. You can't just have one, like when you're eating cookies or chips, right? The same thing can go for alcohol and even caffeine, which increases the amount of dopamine in your brain by blocking its reabsorption into our bodies. So back to SAMe. Studies have shown that SAMe can have a positive benefit on male arousal and erectile dysfunction. However, there can be some side effects, including digestive problems, insomnia, dizziness, and anxiety. If you're bipolar, please speak with your doctor before taking SAMe. SAMe can also interact with certain medications, some antidepressants, amphetamines, and narcotics. Researchers have also examined SAMe's use in the treatment of fibromyalgia and liver disease. It's naturally produced by the body too. So SAMe is naturally going to be produced by your body. So it's really not all that dangerous. So I always warn of the side effects, but they're really nothing major. So you can get SAMe, like I said, it's a natural supplement just over the counter, and the benefits really are great. Should be noted also that you're not going to feel it instantly. So it's not like drinking a coffee and then feeling alert. Most of the research shows that it takes at least a week, possibly 2 weeks to feel any of the benefits there.
You know, on a lot of the blood tests I've taken, I never see SAMe listed. I mean, is that like a special test to get you? I mean, it sounds like an important hormone.
I have no idea if they test for SAMe. I've never seen it either. So I don't know if that's something that can be tested. I've never seen it either, and I've had tons of blood work done. So.
Well, I'm going to find out.
Yeah.
Let you know.
Let us know.
Okay, our next question, Dr. Lee. A woman says, I'm pregnant and have a high sex drive, but all of a sudden, my husband is nervous to have sex. How can I convince him it's okay? Typical, right?
Yeah, well, unless you have a condition that could possibly harm your baby or yourself, sex during pregnancy is usually safe. That's because the baby is protected with the fluid in the uterus and abdominal cavity. You should talk with your husband and ask him what his concerns are. Is he worried about harming the baby? Are there any myths or stories he grew up with that may concern him? Like, what's his problem?
Okay, so this is a common concern. How can you convince a guy, a hard-headed guy, that it won't be harmful?
Well, if your doctor says it's okay to have sex, that should be your answer, right?
A male doctor or female.
Yeah, there you go. Any doctor, right? Ask them or one of their staff if they could speak to your husband, right? Ask them to explain how safe it is, or buy a book or read something online about sex during pregnancy so he can read it and be reassured. Stay away from talking about baby stuff like names or decorating the nursery when you're in bed, because that might just dampen his mood for sex. And while no position is more risky than others, just choose one that's comfortable for you so he doesn't think he's hurting you, and make sure he understands there's no risk to the baby if you have an orgasm.
Great. Thank you for clarifying that. Our last question of the day. A woman says, my husband and I want to get more tools for the bedroom, like toys or pillows. What can we buy that works for both of us?
There are many toys and pillows that would work for both of you, but let's talk about pillows. Sex pillows are ergonomically designed to take pressure off one or both partners' bodies, so it's easier and more enjoyable to try new positions and smooth out some awkward angles. There are wedge pillows that come as a pair or a single, and they're great for taking pressure off of your joints when you're doing a tricky position or if you like deep penetration. They can also help put you in a good position for oral sex. And if you want a pillow, you can leave that on your bed. There's a heart-shaped pillow from the Liberator that is great for doggy style or reverse cowboy, and it doesn't look like some sex pillow. There are also ramp-style pillows that have a double arch design that's perfect for doggy style. It can be great for missionary position because it gives your knees and your back support. Another option is like a half-moon-shaped pillow that's good for both doggy sex and anal sex. The shape allows for deeper penetration and it's more pleasurable. Just about all the sex pillows come with removable covers that are washable.
Do you recommend maybe hiding these pillows when you have guests, or giving them a tour of the house? I mean, it's not as bad as a ceiling on the roof, a mirror on the ceiling, but I mean, these are not that obvious. This could be like a pillow, I mean, right?
Well, some of them are more obvious than others, and I guess it just depends on how much you're embarrassed about these things. I mean, I've got silhouette pictures in the bedroom of people having sex. It's actual pictures. It's artistic, because I'm pretty shameless and I like it there. But wedges can be inflated or deflated like a raft, really. Some swings require a permanent hook in the ceiling. I don't know, replace it with a plant or something. While others are completely portable and they just fit over the door. There's also sex chairs that look like normal lounge chairs but allow for a variety of positions. They're not so cheap though. There are also a lot of discreet sex toys. They even have ones that look like a rubber ducky, ones that look like lipstick. They have handcuffs that are rubbery, so it kind of looks like a bracelet. And they even have butt plugs that are designed to look like a mushroom. so that you don't really know. They even have vibrating jewelry like necklaces or rings, and people have reported feeling like kind of powerful and freaky when they wear them out. It looks like the ring is much larger and it does vibrate it would be kind of used on a female, and then the necklace is just a much skinnier, slimmer type vibrating sexual necklace that you could wear out. That's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.